Hello, my name's Logan, and I'm gonna be your nurse today. I just want to make sure I have the right patient. Is your name Nikki?
Yes, it is.
Okay. All right. So we're gonna. Do you care if I shut the curtains to provide privacy?
Yes, please.
Okay. I'm gonna wash my hands for 20 seconds real quick. So give me a second. All right. I'm gonna ask you a couple questions before we start your examination.
Okay.
Can you give me your full name, please?
It is Nikki Miller,
Okay. Age,
50,
sex,
female.
your level of consciousness. Do you feel okay and everything?
Yes, I feel really good today.
Overall appearance looks good. Your speech sounds good. Can I get your height?
5'6",
Can I get your weight?
230.
Then your BMI is 32.3, and sometimes patients don't know like what BMI stands for, but do you know what BMI stands for and how it's used?
Yes, I do.
So today we're gonna go over your cardiovascular, your breast, axilla, lungs, and thorax, and your musculoskeletal. So
Okay.
right now we're gonna start with cardiovascular. Do you have any chest pain currently, or no?
No, I don't.
Any trouble breathing?
No.
Any like recent surgeries about your heart or anything, or in the
Not
past?
anything recent.
Anything in the past?
Yes, I've had a pacemaker placed 3 years ago.
Okay. Is there a reason why that pacemaker was?
Yes, I had the year before that. I had a heart attack and passed out. They put a loop recorder in to figure out why I had such low heart rate, bradycardia, and then a year later I had another episode and I needed a pacemaker. I had gone into 3rd degree heart block, electrical. So they told me I needed a pacemaker the next day, and that was like 3.5 years ago. I had that
Okay.
placed, but I feel great now.
Okay, that's good.
No problems.
Any cough fatigue?
No.
Edema?
No, I do not.
History of high blood pressure or heart disease or any heart medications?
Yeah, I do have high blood pressure, but I'm currently on medications for that. I'm on medications for my heart because of the pacemaker, so I'm on like 4 different medications for that.
Okay. Do you care if I ask like what kind of medications you take, or?
No, you can ask me. Would you like to know?
Yeah.
Oh, okay. So, I take Cardizem CD. I take Cartera. I take Imdur. I take allergy medication. I take a baby aspirin because of my heart. I take a multivitamin. I take vitamin D. Those are over the counter.
Okay.
That's it
Okay.
that I can think of.
Okay. Thank you. Then I'm gonna ask you some peripheral vascular questions. Do you ever have any like leg pain or cramping?
No.
Any arm, leg? In your arm and leg, or?
Sometimes I do have some swelling in my left arm.
Okay.
That's caused from the pacemaker. I have small collateral veins, so they said that my body is adjusting. They had 2 leads from the pacemaker, went into 1 vein, and my body's trying to develop collateral veins so I can get some more circulation through my arm. But that is all being followed by my heart doctor.
Okay. Do you have any skin changes in your arm and leg ever?
No.
Enlarged lymph nodes? Do you ever?
No, I don't.
No. Medications? Oh, well, you
No.
just told me that. And then Do you have a smoking history?
I used to smoke. I haven't smoked in about probably 4 years.
Okay, so I'm gonna start the examination.
Okay.
So the first thing I'm gonna be doing to you is palpate your carotid artery.
Okay.
So best I stood up. So I'm gonna Alright, seems normal. And then now I'm gonna do the same thing, but I'm gonna use the belt side of the stethoscope.
Okay.
Alright, seems good.
Okay.
Then we're gonna auscultate. So excuse me. Alright, good. Then I'm going to be checking your radial pulse. Doesn't matter which hand. Alright, good. And then I'm going to be checking your capillary refill. So it doesn't matter which hand.
That's my hands, right?
Yeah, it's your hands. I'm going to be pressing down on your fingertips. Or your, yeah. And checking to see how the color looks and everything. And while I'm doing this, you can feel me pressing on your fingers, right?
Yes.
Okay. Alright. So now I'm going to be going to your popliteal pulse check, which, can you extend out your leg a little, please? We're going to go. Okay. And then I'm going to do your posterior tibula. So stick out your foot for me, please. Okay, sounds good. And I'm going to do your dorsalis pedis pulse. So stick your foot flat on the ground for me, please. Alright, everything seems good.
Okay.
Now we're gonna head into the musculoskeletal part of the examination.
Okay.
So, do you have any joint pains recently, or?
I have fibromyalgia, so I have pain all the time.
Okay.
Um,
Is it like aching pain, like
it's like aching pain.
hard to move pain, or just?
Yeah, it's just a constant. It's just a constant pain that I have. It feels like sometimes you have the flu, but I mean, the weather contributes to my achiness sometimes. So.
Okay. So I'm gonna start the evaluation. So I'm gonna do your TMJ, your temporomandibular joint. So.
Okay.
Can you open your mouth, please? And me check your other side. Same thing. One more time. Alright, thank you. So now I'm gonna check your spine.
Okay.
So turn either way, whichever way you want. Oh, okay. So I'm gonna go from the base of your head down to your tailbone. And any pain?
Mm-mm.
Any pain?
No.
Any pain?
No.
Alright, you're good.
Okay.
You can turn around now. Alright. Can you stick both of your arms out for me, please? Let me see. Push up. So we're gonna have your arms stick out, and I'm gonna have resistance, and you're gonna push up.
Okay. Okay.
Good. Strength is a 5, and then can you move your arms in a circle, please? And any pain there?
No.
Okay. So you're gonna do like a bicep curl, really,
Uh-huh.
and I'm gonna have my hand on your forearm,
Okay.
and I'm gonna see if any resistance. How you do? Good.
Okay.
Good. All right. Strength is a 5. All right. Now I'm gonna have you put your arms like this, like in a bicep curl.
Uh-huh.
And I'm gonna put my hand here,
Uh-huh.
and you're gonna push out.
Okay.
Same with next arm. All right. Strength is good. Next, make a fist, and I'm gonna push down on you.
Okay.
You're gonna wanna push up. I'm gonna push up. You're gonna push down. I'm gonna push out. You're gonna push in, and then. Okay, seems good. Strength is a 5, and then let me give you my fingers, and you're gonna squeeze them.
Okay. Squeeze?
Yep. Okay. Good. So now we're gonna go down to your legs.
Okay.
So whichever way makes you feel comfortable. This one we're gonna do. I'm gonna push your leg. You know, I'm gonna need you to stick your leg up a little, like this, and I'm gonna push, and you're gonna push out. Good. Same thing. Good. Same leg on this leg. Okay. Good. Then I'm gonna need you to, can you take off your shoes? Wiggle your toes. Do you feel that?
Mm-hmm.
Okay. Your sensation is intact to light touch. So I'm gonna check your pulse too on your feet. Seems good. Then we're gonna lift your feet up, so you're gonna have your feet flat, and you're gonna push up. Okay, and then keep your feet up. Then you're gonna push down. Okay, good. So we're gonna come back up to the top, and I'm gonna have you hold your wrist like this for
Like
a minute,
this?
and I'm gonna see how you feel after. Five more seconds. Alright, you're good.
Okay.
Yep, you're good. You can let go. Do you have any numbness or tingling in your hands? No?
Nope, none.
Okay, good. Then I'm gonna have you flip your hand like this in supination, and then I'm just gonna go from here and make sure you still have feeling. You feel that?
Mm-hmm. Yes, I do.
Feel that still?
Yes.
Alright, that is the last thing I needed for the musculoskeletal. So now we will go to the breast and axilla and the lungs and thorax. Alright, so the last part we have is breast and axilla and lungs and thorax. So I'm going to start with the questions. Do you have any pain in your breast area?
No.
No? Lumps?
No.
Tenderness?
No.
Ever been discharged?
No.
Rash, swelling, trauma?
No.
Has any doctor ever told you about any breast disease that you've had or
No.
Any surgery?
No.
Any drugs that you take for your breast?
No.
No. Ever done a breast self-examination?
Yes, I have.
Can I ask when that was, if you don't mind?
I did one last month.
Okay. Age of last mammogram?
49.
Okay.
Had it done last year.
Okay. Then I got some questions about the lungs and thorax. Any cough?
Mm-mm. No.
Difficulty in breathing?
No.
Chest pain?
No.
Respiratory infection?
No.
I already asked you about that. Are you exposed to our environmental exposure, such as like bad chemicals while you're out
No, I'm
and
not.
about? No? Okay. Alright, so we're going to start your examination. So I'm going to evaluate for chest expansion. So
Okay.
I'm going to have you turn around.
Okay.
And I'm going to put my hands on your back.
Okay.
And I'm going to need you to breathe in and out. Couple more. Alright, thank you.
Mm-hmm.
You got no disformatories, no respiratory distress.
No.
And your lungs were pretty symmetrical.
Okay.
So now I got your tactile fermentites. So I'm going to use the palm of my hand on your back to feel for vibration. And I'm going to have you, if you could, repeat the phrase 99 for me, please. Okay.
You want me to turn around?
Yeah, actually, can you turn around again, please? 99.
99. 99. 99. 99. 99. 99. 99. 99. 99.
One more.
99.
Okay. Thank you. Seems good. And then, I'm actually going to have you turn around again because I'm going to be checking your resonance. So,
Okay. Turn back the way I was?
yep.
Okay.
Good.
Good? Okay.
Alright, one more where you have to turn around. I'm going to use your stethoscope, my stethoscope on your back of the lungs
Okay.
to listen for some extra sounds.
Okay. Sorry, I keep turning around. I'm just nosy.
Oh, you're fine. Just breathe in and out. Alright, your lungs sound good.
Okay.
So now we're going to evaluate for symmetric chest expansion.
Okay.
So you could lean up on your chair a little, and I'm going to need you to breathe in and out. More. Alright, seems good. Alright, so now, just like I did on your back, I'm going to do the tactile fermentites. So every time I move my finger, I'm going to need you to say 99.
Okay. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99.
Alright, thank you. Same thing like I did on the back. I'm going to see your resonance. So you don't have to say anything here. It's gonna be... Alright, seems good. Alright, one last thing. I'm going to take the stethoscope and let me listen to your lungs.
Okay.
Alright.
Okay.
Lungs sound good. Everything sounds good that I examined you today. Thank you for coming in.